motion to approve the minutes that we sent out from our last meeting.
Yeah. I'll make a motion.
Anybody object? Okay, good. Okay, Wayne, you're on the hot seat. Anything from the commissioners?
Not at this time.
You want this in?
All right, sounds good. Chief, do you want to give any updates?
In reference to, I wasn't at the last one, so I
Just
don't know.
updates on anything in Lehigh and in the homeless encampments and all of that good thing.
Well, we always see our growing population as the summertime months move on here. There's more people that are more actively in the streets. We have some, our variety of call volume. We have issues that we have in the areas that are along the river still. We haven't had opportunities with my staff and really able to really get out there as much. We handle call volume as it comes in, and I know Dane's been working with the commissioners to have a plan in action to try to eliminate some of the structures and some of the things that are going on out there. It hasn't, we had some beliefs that it was going to happen before the summer. It hasn't happened yet. But we're hopeful that maybe in the near future before fall hits, should that's a possibility to be able to get out there and work those areas and eliminate some of the structures that don't belong on either county property or borough.
Gotcha.
Adding to that, I think, I'm hearing complaints about the people at the trailhead there and everything. And those that are walking the trail are even afraid to go up to that pavilion there. So it's creating a problem, and I'm a little disappointed really. Last year when we put that dumpster there, we had people we talked to when we went in there, yeah, they're gonna clean up, they're gonna, take care of it and everything. I was told some of the volunteers are gonna go in there and help, and that dumpster was there for how long, and they never filled it. The place is continuously been a heck of a mess. Certainly is a health hazard, and I don't know, I don't know what the answer is, but it just cannot continue to go on. The county will be working with the borough on doing whatever we have to clean it up, and I'm hearing now that they're have a structure that they're working on the second floor, of a wood structure.
I mean, the trailhead's an issue, don't get me wrong, I'm not saying it's not. We handle call volume there as it comes in, as the complaints physically come in. My biggest difficulty is, we have our own problem when it comes to staffing, and outside of this one concern and issue that we have in the county, with the reason why we're here today, I still have other call volume that I have to handle, so this isn't what I'm dedicated to. So we handle it as it comes in and as we have to address the situations that are there. I agree with the fact that there are people that hang out there at times. I'm not saying that it probably may prohibit people from utilizing some of that space. I know people that go down there and those people aren't bothering the ones that are using the trailhead in itself. They realize that they're down there and they go about their business. So I hear both sides of it, and we try to do the best we can with the manpower that we have at the times that things come in, so.
And touching off of what Commissioner said, it's not just a health hazard, this is a fire safety concern. If we have structures that are built illegally, we just watched 600 acres of county land burn
Right.
3 months ago. We're so easy to forget, but we have people burning things in the middle of the woods, in the middle of a drought 3 months ago. That 600 acres could have easily been 6,000. We could see the scars of that from this building. And
What they're burning in addition, it's just not paper and wood.
yeah, and that was 2 years ago. That was one of the first complaints on my desk when I took this role, was that, we had tire burning happening across from the canal. And we have a lot of people, specifically elderly people that live in that area. They've been there their whole lives. And all of a sudden they need new HVAC equipment to get the smoke out of their house. So there's a lot of layers to this one, a lot.
Absolutely. I don't know, I'm sitting here thinking, there's no easy solution. We could maybe, I don't know if the outreach Committee. Marcia, can you hear me? Marcia, are you there?
Yes, I'm here.
Marcia, I'm wondering if we could get, some of those materials and leave them at the pavilion, like the resource cards.
Okay.
At least that's something, that they're aware of where to go for help. I unfortunately don't know if the folks down there want.
I don't know specifically that I mean, you can do that, but I don't know that the majority of the people that are there because they don't know where to go or what resources that are available.
Right.
We've been down there, we've been through there enough times to let them know how to contact, or even to contact the local police department to be able to provide them with that information. So it's not that. I think majority of the people that are there by choice, and I think it's a conscious decision that they make in some instances. In some, I'm saying that's not that way for all of them. But I believe a large portion of them may be that way. And they've been aware of what some of the resources were in the county. We went out and we did our suits with the sheriff's department and we provided them with information. And we never got any feedback or comments from the people. Nobody, if there's an issue, they all have phones. It's not like they can't call us. When there's a problem down there, we do get notified of things and they do make phone calls to us, or if there's a medical issue that goes on and we go down and we address it. So if they have the ability to contact us, then they have the ability to contact us. I've given my cards out. I know the sheriff's department's given their cards out when they've been down there talking to people, and it's not like they're sedentary in that area specific where they can't leave. They're always out and wandering in the lower portions of our borough at times as well. So they don't have the means of getting the information, but.
Yeah,
Can I,
sure.
the only other problem is, and you're right, many of them have never even contacted our agency. We have, some people that were down at the encampment, but we have housed a few individuals that we were capable of doing. But one of the largest problems right now, come July 1 and forward, is many of us are out of money.
Right.
Many of us have no idea what the budget's going to be, whether our programs are even going to exist. Some of them may not be, or they may be cut. Some of the housing programs may be cut. The homeless assistance, homeless prevention, we just simply don't know. And it's not just us, we talked about this at a meeting yesterday of the housing, the service planning committee and most agencies. We simply don't know from a state level or a federal level.
To pass the budget, we have no idea, and it's gonna take weeks to find out what we're not gonna get maybe. How do we make up that funding? What programs are gonna be funded? In the meantime, I think a lot of the agencies still have to provide those services, not knowing when we'll get reimbursed. And it's been a big problem over the years,
I mean, even Family Promise, part of our thing is eviction prevention, which I refer to you guys,
And we've been continuing
Right.
to whatever level we can.
Right.
We've exhausted what we have available. I don't have funding releases, but I got my board to allow me to authorize it, knowing that we have some monies through the end of December coming our way. But beyond that, some of the programs we simply don't know.
It's truly. It's a scary time. Anybody have any input that's joining from Zoom?
Hi, I'm Mary Penny. I work for the Eastern PA COC. So I live and breathe the funding every day. The COC, for those who don't know our acronym, is the Continuum of Care. We're the entity that works with all your local organizations to file the giant NOFO, the Notice of Funding Opportunity, the grant that funds local programs. We keep the data and do the administrative end of that. So I can tell you that HUD has made a decision, and they sent us a very cryptic announcement 2 weeks ago that we had secured funding for 2 years, a 2-year NOFA. It was a big deal. It was a bipartisan vote last year and went through swimmingly, and we were all excited because we weren't going to have to do the grant process every year. It was going to be for 2 years. They are pulling that back. We don't know what they're pulling back or if they're going to refund programs or create new ones or cancel programs. We're waiting to hear from HUD what the NOFO, the Notice of Funding Opportunity, entails. So that's all brand new and will affect your local providers greatly, especially if they end programs or cease funding programs. And also, we do know that on a federal level, that the House announced a bill that to fund programs and the COC. So we know that they have decided in the House, at least, not to dismantle the current homelessness system, which was part of the discussion, that they were going to end COCs and block grant the dollars on a state level. So in the House right now, they're not talking about doing that, but we don't know what's being talked about in the Senate. So it's a long process. If you have the ear of any federal lawmaker or senator, and would like to chat with them about how these programs are needed in your community and that the need is great and that by ending them and dismantling the system would probably not be helpful, it might be a good time to talk about what your community needs to local and state and federal lawmakers. And I don't know if I have a lot of answers to any questions. I just live and breathe it every day and read everything possible that comes out. But if you have questions, I'll try to answer them.
Kathy,
Go ahead, Rob.
the only other solution, and it's not a solution, it's just another Band-Aid, but we also should just kind of collaborate more with MH and drug and alcohol, only because many of the individuals who might be that we're all talking about here may have those needs also. And if we can also connect with their outreach teams, that might be another supportive role. Again, I understand exactly that I don't think it's anything new, but again, it's just to keep that collaboration moving forward because many of the individuals fall into those realms also.
Absolutely.
So this is Jamie from Drug and Alcohol. I think, we spent a lot of time over the winter in trying to engage that population. I spent every Friday at the warming shelter. And, we have established with a lot of those folks, at least a relationship that they know who we are. A lot of them do stop now at the office, sometimes to charge their phones, things like that. We have managed to engage some of them, but a lot of needs, like we've had some grant funding through a small grant that we had, that we were able to provide some kind of basic need things like to them as needed to try to again engage them into services. But as Chief Abelovsky said, there is a portion of those folks who are choosing to live in that manner and really don't really want to engage in things. So it's trying to concentrate on the ones that we've seen at least a glimmer of like wanting to get help. Now we do, have a full case management unit that works on all of those kind of non-treatment needs that people don't even need to be active in our treatment program to have a case manager. So, those folks help people to get things like IDs, which in order to do a lot of things you need, and then we pay for those kind of things that kind of sometimes get in the way of people making some changes. But as far as the other piece goes, we're in the same boat as Kim said, budgetary wise, we are a private nonprofit entity. I have my money's in and out. So it's not like I have a big nest egg sitting here waiting, at this point, I'm going to be already evaluating what my next steps are if something doesn't happen soon with the budget, because we won't even be able to pay our staff to be here.
I sympathize, Jamie, and I do want to get together with you to if you have the manpower or whatever, if you want to do a drop-in kind of intake service at the jury center. We have our construction issues have been resolved and our water line and our It's been one interesting ride there, but we're good now. So Jamie, we could touch base next week.
Actually,
Interested?
the following week, next week, most of the week, I'm at State College for our state association meeting, so,
Okay, next week, the following is good.
great.
Okay, we will move on to shelter reports.
As of today, we had 6 families in there, 1 single woman. And Monday we'll be back at full capacity. We're right around 14 children and 10 adults be there. And like she said, we got everything working over at the resource center. Everything's looking pretty good, so.
Been, we do have a long list, we have over 100 families on our wait list. And it's incredible, and what happens is they'll call, they'll come for the intake. And then they won't tell you when not show up, so sometimes you have to chase people, which you could just move on to the next person, so. Well, we're certainly busy. Janet, do you want to do the?
Yeah, sure. Keeping in mind that our money is limited and we're trying to stretch it out as far as we can. Since April 1st, we've had 134 people call in looking for different types of assistance. Some need electrical, some need housing. That's a combination. And of those 134, 22 have been actually street homeless. Not doubled up, but actually on the street. We've been able to enroll 46 households since April 1. And of that number, over the course of those 4 months of those intakes, right now we have currently 48 households that we're serving with case management. We get HMIS referrals through the 211 system. We got 32 of those. Some of them we can help, some of them we can't, I call them and find out what their situation is. The case notes that we get are not complete enough to be able to get a picture of where they're at. So I follow up with phone calls at least and try to give them suggestions if we can't help them. And there is the by name list also, which we haven't been working on since we don't have ESG, we don't have the programs to assist those people, but there are 23 of them on that list. So there's a good number of people out there looking for help. And I often wonder of the call-ins, what happens to the ones that don't call back and we don't hear from them again? Where do they go? What do they do?
I don't know, I mean, we had, I think it was 96 or 97 calls, last month, just between eviction prevention, opioid, homelessness, so. We're trying to case manage those folks, but
On your calls that you receive, you give the numbers of maybe 97 last month. Are any of those repeat callers that call maybe every month, so we have a better idea of how many people are really in need of it? Maybe only 50%, maybe, you know what I'm
Well,
saying?
usually call back on Monday and check, and it's hard because you gotta tell them no, if you're full. And you don't know, it could change overnight, dude, so I just tell them to
No.
call back and we'll see if we talk to them again on the next Monday. And see if we could help them out.
no, I found maybe 25% are like, they were in trouble last month and then they're in trouble again this
Yeah.
month.
Repeat.
Right, but a good majority
Are not.
are not.
Yeah.
are-
There's duplication obviously between
Right.
our numbers because you're referring to us, the
Right.
ones that are,
Yeah.
but, and
So there's no way to really track those individuals? You don't keep a list or anything or compare
We could,
those?
yeah, we could.
You do?
Mary,
I'm not sure we have
We do.
staffing.
I mean,
Kath.
we keep a list of who's calling in and compare, like you'll remember, like when you hear
Yeah.
the stories, you know who it is. But yeah, we keep lists of who's calling in, so,
Kathy,
yes.
And actually, this is a question for Mary. Mary, couldn't we also get some good stats from the by name list?
You can, we can work with, the folks from the Coordinated Entry Committee and get whatever you need. And Jason Alexander is the, COC's consultant that runs the by name list. So if anybody wants to talk about, and coordinated entry is not my, area of expertise, but we can definitely get a lot of information from the by name list and from the data they keep at 211.
Again, the by name list though is homeless, street homeless. There are the numbers then that we're saying where we also get through HMIS with it, which is homeless prevention.
That's
Yeah.
32, yeah, referrals.
So the by name list is strictly, I stand corrected, street homeless or domestic violence.
Right, and the calls we get are, I have a notice, I'm gonna be evicted. Who do I call? Do you help with that?
me.
And frankly, we find that we're helping more homeless prevention now than rapid rehousing because of the very problem we've been talking about for the last year. The housing situation, the access to housing, the affordability of it, the cost, given the current, as a matter of fact, there's some statistics, and I didn't know if Rob was gonna touch base on this, but I wanted to get copies and I didn't get it out. We'll get a copy to you to send to everybody. But the Housing Alliance put out some information on the cost in Pennsylvania. Just, then they have it by metropolitan area as well. But in Pennsylvania, the fair market rent for a 2-bedroom apartment is $1,447. In order to afford this level of rent and utilities, without paying more than 30% of income on housing, a household must earn $4,824 monthly or $57,886 annually. Assuming a 40-hour work week, 52 weeks per year, this level of income translates into an hourly housing wage of $27.83 per hour. When you take what the minimum wage is and the average wage in the area.
But does that report even take into consideration childcare? You have family with
No, this is-
childcare and the cost of childcare.
This is just based on
Based, yeah.
30% of your housing cost. And 30% of your income being housing cost. That's what you need to earn in order to be at that level or below.
Our clients aren't earning anywhere
By
near.
no means. By no
Nowhere
means.
near.
My staff stuff.
So what happens is people that are doubled up, which could actually still fit under a homeless prevention program, but they no longer have a place of their own. It's almost impossible for them to find a place because the available places are out there have probably 12 or more people applying at the time. You know this. Rob knows it. This is why Rob's even having difficulty with his vouchers. So we're finding it, we're doing a better job with our money, trying to keep the people who are in their homes to remain in their homes, rather than being out on the street facing this issue that everybody that is on the street or doubled up is facing. We're
It's-
trying to keep people in their homes.
Yeah, it's daunting, I have our program's 90 days. I have a family that's there 297 days. They're working. They have the money
Can't find
they can't find anything. Because they look terrible on paper.
Credit reports and background checks are holding up a lot
Yeah.
of these.
Yeah.
intakes.
And I saw something, not to scare everybody, but I saw something on the news today that they're proposing a bill to limit HUD's, Rob, did you see this? That they want to limit subsidized housing
2
to
years.
2 years?
Yeah, I did. But and that's just being proposed right now, but I have heard that for a while. So yeah. How about I just go, that was like a lead into some of the reporting that I was gonna kind of do, and so why don't I just kind of
ahead.
flow with it?
Go ahead.
At our last meeting, we were talking about landlord engagement, and that's still possibly on the schedule to do something in September, and hopefully that'll come about. But in doing so, there was some PR that was going to be needed ahead of time to follow up with some of the stats. I looked at our fair market rent with regards to 2020 and what it is now. And it's been almost a 35% increase in some of the numbers. And for the fair market rent, which was just being mentioned there, for a 2-bedroom, it's 1,507, 1,507 for our area, Carbon County. And with regards to the numbers that do take into account childcare and a number of other issues, what I've also been trying to find is something that would be very helpful. The Economic Policy Institute put out a family budget calculator, and it gives a lot of those same numbers of what you have to have as a monthly income and an annual income in order to afford rents. And it can be broken out by different family sizes. A single parent with one child, a single parent with 2 children, a 2-adult household, and it kind of goes, you can vary and you can put in and calculate some numbers. From more of a national stat, again, I was trying to find something which, if I'm going to be putting some PR information out there, in 2025, the State of the Nation's Housing Report was just published in June 25, and it was something put out by Harvard University. And that some of the key trends, it talks about home ownership is increasing out of reach for low and moderate income renters. Affordable housing production is stalling. And here's the other important key, which was just being discussed. Federal housing support is not keeping pace with rising costs. And it talks about an average household now requires an annual income of $126,000 to afford a typical home. And that's beyond 85% of the renters nationwide. So that kind of gives you some perspective. Marcia, Gina, and I met pretty recently, and we were thinking about putting together a planning grant to kind of pull in a number of the groups, our group, the Blue Ribbon group that's meeting up in Panther Valley, and maybe have some discussion on a planning grant in order to decide on what affordable housing needs are attainable, and maybe the Housing Authority can move forward in that direction, and that'll give us some ideas. But we're kind of stretched also with regards to federal funds, and what we're hearing is there's going to be reduction. So a lot of the areas that we're all discussing, we are going to have to work collaboratively, and that's all I keep saying, because with the minimizing of funds, I think it's going to have to pull us together more in order for us to work in a way that's different. And that's all I can really express right now, because it seems like everything that we're sharing here is doom and gloom. But I do think if we can help some people, we have to target our populations and really figure out how best to move forward. Our next meeting is on July 31st. It'll be at 3 o'clock, and it'll be at the Housing Authority.
Okay, thank you. Marcia, do you have anything to add?
No, nope. Now that we've combined with Rob's group and we're just one big group, that he covered everything.
Does anyone have anything else they would like to bring up?
I actually have some good news. This is Mary Penny again from the Eastern COC. So we are working right now with a consultant that we're working to contract with to do it through the 33 counties of the COC, to do like a plan and documents and marketing materials over the next year for landlords to do landlord recruitment and landlord engagement. So that's going to be something that we're going to be able to help all entities that are part of our RAB system or part of the COC. And you'll be able to share that information with other organizations in your community. We're going to be talking about how to replicate some of the things that happened in the Lehigh Valley. And Rod may be aware of some of the work they did with a consultant in the Lehigh Valley. A woman named Lizzie Goddard did some planning, and they created a system to engage landlords and using landlords incentives. And along the line of landlord incentives, the Eastern COC was awarded FAIR dollars, a FAIR grant for the last few years, and all that money is spent for landlord engagement. And we are going to continue to use that fund for landlord engagement right now. If you're not in contact with the United Way of the Poconos, I will get some information to you all about that. They still have more money left in their landlord engagement fund for this round and will have more for next year. That is a stackable incentive to give landlords to take folks with poor credit that have possibly a criminal history or other limitations, bad landlord references, to help landlords incentivize them to take the person as a tenant. You can stack those. I believe it's, don't have there's 5 RABs and each one has a different proposal, but I believe in the Poconos RAB, which covers the Carbon County, they did $1,000 for each incentive, so you can pay the landlord up to $3,000. The only caveat is the person has to be categorized as currently homeless. So if it's someone that is doubled up or someone that is staying with a friend or something, they don't fall into that category and the funds can't be used for them. And I will get more information so you guys can send that out to everybody if you don't have it.
That would be great. Thank you, Mary. Anybody else with anything? You know, I'm wondering how many people down at the, they're camping out in this place. Are they, many of them from the warming shelter? That was in Lehighton or?
Possibly. We are seeing new faces, for decades, we've recognized many of them and we still do. More recently, it's been people that we don't recognize. That may not be local.
The question is, how are they coming in from out of the area?
Well, see that? I should say this here, that's my concern with Family Promise having a warming shelter at the Jury Center this winter. Are we bringing more homeless people into the area and then they're stuck here? It's like a double-edged.
I mean, the community wants to do the right thing for these people.
Right,
That's,
absolutely.
we're all here for the right reasons. But what it comes down to is when other areas don't have facilities, and we do, to some degree, they come to our area for those services, but then those services sometimes aren't adequate for all the members that come. But they hear about it and they come to our area. And that includes when people come for treatment, whether they're going to the hospitals, and maybe there's, and maybe Jamie can talk about when it comes to some of it, but maybe not all of it, when it comes to like, what is the discharge plan for some of these hospitals? When they go to relieve these people from after they're done staying in our area, when they're brought into our community from outside the area, from the Lehigh Valley or from wherever else, if the hospitals don't have a discharge plan in place and these people have no place to go, well, they hear about some of the facilities that are possible in the area and they go, and sometimes they're available, sometimes they're not. And then if they don't have extra resources, and they find themselves, down potentially along the river area that we have in Lehigh, unfortunately. And that could be how some of these people are becoming into our area, but.
I get calls several times a week from social workers at hospitals. Oh, I have a single male. And I refer them to Peaceful Nights because I take single females and I take families, but I don't have room anyway. So, yeah, we get those calls all the time.
So these people
So
are
a
coming
piece
in.
of that is the fact, as Chief Avalosky was saying, like, with the hospital, there's, a lot of folks now, the way that works is wherever there's a bed available in these health systems, so we're getting folks like on our mental health units and things like that, or from the Valley and things like that, that aren't really local folks, but if that's where there's a bed in their system, then that's where they end up, kind of thing. I will tell you, in the time of being at the warming shelter last winter, the majority of folks were local folks. I can probably on one hand tell you that the folks that I did not know, like that have, that we have not encountered at some point in time, or weren't people that I knew were from Carbon County. So a handful of folks like that, couple that got up into the area, likely, doing something that was not healthy, and then couldn't get themselves back down to Philadelphia or wherever they may be from, but the majority were local people.
Yeah, I was just curious, Jamie. I didn't know what it looked like. I also get calls from couples that don't have children. That's a underserved population too. Because I know that, Peaceful Nights will take single men, I take single women, but there's not really anywhere for a husband, wife, boyfriend, girlfriend, whatever,
And they don't want to separate.
and they don't wanna separate.
And I think a piece too that comes with that, those couples is, engaging into this kind of group is somebody from like the domestic violence. Because that's something that I saw a lot of back and forth happening, and a lot of, power control relationship kind of things, where the guy might be buying the girl her dope kind of thing, but there was abusiveness going on in the situation, lots of injuries and, different things that they say, oh, I fell down the steps or I did this, but clearly there was some other things happening. So being able to, again, engage. And I think a key to all of this, like I said, when it comes to any warming shelter, Kathy, whether you decide to open one or not, is that really trying to engage all of those human service agencies to be a part of it. Because, until those people start seeing some kind of resources happening, it's just the same cycle over and over and over. Like I would tell them every day, do something today, set a goal. I don't care what your goal is, but make a goal for today, how small it may be. And there are people and agencies out there that can help you, but you have to take the step to do something.
Well, that's the key, Jamie.
And it takes a long time to get that population, you all know this, I'm preaching to the choir, to trust you. So, it was a long time for me just going over there before they were even willing to speak to me.
Agreed. Well, anybody have anything else? Okay, we can set our next meeting. Thank you all for coming on a beautiful Friday morning. I'm looking at September 19th, so this will be a little. 9 o'clock, September 19th, good for everybody?
Here,
Is it more convenient for you guys here or over at Family Promise?
here, us, here.
All right, here, I do have snacks when we meet there, but. Coffee. Here's. I think I'll stop and get coffee next time. So, okay, here's good, 9 o'clock.
We'll send you a copy of this, okay?
Thank you.
We'll send out to people.
Yeah,
You
it's,
might not have.
it's, I know it sounds doom and gloomy. But
But that's why